everyone, I'm Dr. Hina from Hopewell Healthcare Center. Today in this video, let's discuss about vitamin D, its sources, causes, symptoms, treatment and its prevention. Vitamin D is a fat-soluble vitamin required for calcium homeostasis, bone maintenance and metabolism. It is also required for immune system functioning and various other functions of our body. From where can we obtain vitamin D? It can be obtained or acquired by three ways. That is through the skin, diet and supplementation. Food sources that are rich in vitamin D. Yes, dietary sources rich in vitamin D are animal food products such as meat, then oily fish such as salmon, sardines, mackerel, etc. And also mushrooms, egg yolks and fortified cereals is rich in vitamin D. When exposed to sunlight, our body or our skin can synthesize its own vitamin D, and this is now known as endogenous synthesis. Remember when I said when you are exposed to sunlight, you'll be able to absorb vitamin D. That doesn't mean you can go during any time of the day. You have to remember that the best time to absorb vitamin D is the time between 7 to 9 a.m. in the morning and 4 to 6 p.m. in the evening. And it again depends on the weather, whether it is summer or winter. And this is because to avoid the complications like sunburn, heat stroke, and various skin cancers. Cancers not every time. It is going to happen when you're exposed to sunlight for a very long time, and that too the sunlight which is very strong during the daytime. And it also depends on the duration, like for how many months or years before the cancer is actually diagnosed. And also vitamin D deficiency has been associated with several types of cancers like prostate cancer, colorectal cancer, breast cancer, etc. So deficiency and also excess of sun exposure will lead to various cancers. So moderation is the key. Let's discuss about the causes of vitamin D deficiency. Number 1, limited sun exposure. Spending little or less time outdoors or living in areas with long winters can reduce sun exposure, and this will in turn result in lack of vitamin D. Number 2, dietary deficiencies, that is not consuming enough vitamin D foods can lead to a deficiency. Number 3, age is also a factor. Yes, age is a factor. Older adults may have a reduced ability to synthesize vitamin D from sunlight. Number 4, health conditions. Certain conditions like celiac disease or Crohn's disease or kidney diseases may interfere with the body's ability to absorb or metabolize vitamin D. Obesity. Excess body fat can sequester vitamin D, reducing its availability in the bloodstream. Now let's see the symptoms of vitamin D deficiency. Number 1, it may lead to bone pains and muscle weakness. It will lead to fatigue and tiredness, and it will increase the risk of illnesses and also the susceptibility of infection due to a weakened immune system. It may lead to hair loss and hair thinning. It will also lead to a condition known as osteomalacia in adults and rickets in children. This is when there is severe vitamin D deficiency. Vitamin D deficiency is majorly related to hair, skin and nail problems. It will give acne breakouts and other skin conditions like pigmentation, melasma, in rare cases melasma, and also it may have brittle nails. Treatment for vitamin D deficiency. Number 1, sun exposure. Aim for about 10 to 30 minutes of direct sunlight exposure several times a week. Number 2, eat more vitamin D rich food sources like fortified milk, fatty fish, eggs, etc. And number 3, in cases of severe vitamin D deficiency, your doctor might suggest you vitamin D supplements, either vitamin D2 or D3. and the supplementation should be under the doctor's prescription. How to prevent vitamin D deficiency? Number one, ensure adequate intake of vitamin D rich food, or you can go for the supplements after doctor's prescription. And the best way could be the sun exposure for 10 to 30 minutes a day. And the second thing, regular blood test can help monitoring your vitamin D levels. In case you have severe vitamin D deficiency, it is important to consult a doctor for diagnosis and treatment recommendations. Stay tuned for more such videos and like, share and subscribe to my channel. That's all for today. Take care. Thank you.